I've seen how many of my patients are doing everything they were told to do. They're taking their medications. They're cutting the salt shaker off the table. They're avoiding red meat. And their blood pressure still won't come down. Or it comes down a little, and then it creeps right back up. And here's what nobody is telling them. The problem isn't their willpower. The problem isn't their age. The problem is that the dietary advice most seniors receive for high blood pressure is dangerously incomplete. Most doctors focus on what to remove from your diet: salt, saturated fat, processed food. And yes, those things matter. But what the mainstream conversation almost never addresses is what to actively add. Because there are specific foods, common, affordable, available at any grocery store, that contain compounds your blood vessels are literally starving for, compounds that relax arterial walls, compounds that reduce inflammation in the cardiovascular system, compounds that help your kidneys flush out excess fluid and regulate pressure from the inside out. And when seniors don't eat enough of these foods, which most don't, because nobody told them to, their blood pressure stays elevated no matter how many pills they take. In this video, I'm going to reveal the 5 scientifically validated foods that seniors can add to their daily routine to actively manage hypertension. Foods backed by research from institutions like Harvard Medical School, Johns Hopkins, and the American Heart Association. We'll start with number 5 and work our way to number 1, which I have to warn you is the most surprising. Number 1 is a food that most seniors eat occasionally and think nothing of, but when consumed the right way at the right time, research from the National Institutes of Health shows it can reduce systolic blood pressure by as much as 8 to 11 points in just 4 weeks. That is medication-level impact from a food. So stay with me from beginning to end, because what you learn here could change your numbers, and quite possibly your life. But before we dive in, I want to hear from you. Drop a comment right now and tell me, how long have you been dealing with high blood pressure, and what has your doctor told you to do about it? We personally read and respond to every single comment on this channel, and your answer helps me make videos that are actually useful to you. Now let's begin with number 5. Number 5, spinach. Spinach is one of the richest dietary sources of inorganic nitrates on the planet. When you eat spinach, your body converts those nitrates into something called nitric oxide. And nitric oxide is essentially your blood vessel's natural relaxant. It signals the smooth muscle lining your arterial walls to loosen, to dilate. And when those walls dilate, blood flows more freely and pressure drops. After the age of 65, your arterial walls naturally begin to stiffen, a condition called arteriosclerosis. Stiff arteries don't respond as well to your heart's pumping rhythm, and that forces your heart to work harder just to push blood through. Nitric oxide directly counteracts this stiffening. It's not just lowering pressure, it's addressing the underlying mechanical problem. A landmark study published in the journal Hypertension followed 67 adults with elevated blood pressure over 8 weeks. Participants who consumed a daily high nitrate supplement derived from leafy green vegetables, equivalent to 2 cups of spinach, showed an average reduction of 8 millimeters of mercury in systolic blood pressure. To put that in perspective, many first-line blood pressure medications produce reductions of 5 to 10 points. I had a patient named Walter, a 71-year-old retired electrician who came to me after his doctor added a second blood pressure medication to his regimen. He was frustrated. He felt like his body was failing him. We made one simple dietary addition: 2 handfuls of raw spinach every morning blended into a smoothie with banana and water. Nothing fancy. Within 6 weeks, his systolic pressure had dropped 11 points, and his cardiologist was able to reduce one of his medications. Walter still calls the office every few months. He says it's the first time in years he feels like he has some control over his own health. You cannot afford to overlook the foods that regenerate your vascular system from the inside, and spinach is the foundation. But what I'm about to share next takes this principle even further. Because while spinach works through nitric oxide, the next food works through a completely different pathway: your kidneys. Number 4, bananas. There is a critical mineral that over 70% of adults over 60 are not getting enough of, and its deficiency is one of the leading and most overlooked drivers of high blood pressure in seniors. That mineral is potassium. Your kidneys regulate blood pressure in part by balancing sodium and fluid in your body. Potassium is the key that tells your kidneys to release more sodium into the urine, and when sodium goes out, fluid goes with it. Less fluid in your bloodstream means less pressure against your arterial walls. A comprehensive analysis published in the Journal of the American College of Cardiology examined data from 33 clinical trials involving over 128,000 participants. The findings were definitive. Increasing dietary potassium intake was associated with a 3.49 millimeter of mercury reduction in systolic blood pressure and a 1.96 point reduction in diastolic pressure, independent of sodium intake. Getting more potassium helped blood pressure even when sodium wasn't reduced. Bananas are one of the most potassium-dense, easiest-to-eat foods on Earth. A single medium banana provides approximately 422 milligrams of potassium, along with magnesium, vitamin B6, and soluble fiber. One of my patients, Dorothy, a 74-year-old retired schoolteacher living alone, wasn't a big cook. She needed simple, no-prep solutions. I told her, 1 banana every morning. That's it, 1 banana. She thought I was being silly. But Dorothy came back 3 months later and told me her home blood pressure monitor had gone from averaging 152/91 down to 138/84. She hadn't changed anything else. Potassium helps your kidneys control pressure. But the next food works directly on inflammation inside your arterial walls. And this is where most blood pressure conversations never go. Number 3, beets. Beets are extraordinarily high in dietary nitrates, but beets take this further. They also contain a unique antioxidant pigment called betalain, which has been shown to reduce oxidative stress in vascular tissue. When blood vessels are inflamed and oxidatively stressed, they constrict. They become narrower, stiffer, and more resistant to blood flow. Blood pressure climbs. Betalain works alongside nitric oxide to reduce that inflammation and restore vessel flexibility. Research from Queen Mary University of London conducted a controlled trial with 64 hypertensive patients over 4 weeks. Half consumed 250 milliliters of beetroot juice daily. The other half received a placebo. Results showed that the beetroot group experienced an average reduction of 7.7 millimeters of mercury in systolic blood pressure and 2.4 in diastolic. These changes appeared within just 24 hours of the first consumption and remained sustained across the entire 4-week period. I want to tell you about Raymond, a 69-year-old retired postal worker who was dealing with what his cardiologist called stubbornly resistant hypertension. His doctor was considering adding a third drug to his regimen. Raymond came to see me for a dietary consultation. Among other changes, I introduced him to 1 glass of pure beet juice, not the sweetened kind, plain beet juice, 4 or 5 mornings per week. In 8 weeks, Raymond's systolic pressure had dropped from 158 to 144, enough that his cardiologist put the third drug on hold. Raymond told me, "I would have laughed if you told me beet juice would do more than another prescription. Beets protect and relax your vascular tissue, but the next food works through a completely different system, your gut, and the results are just as powerful." But before we continue to the top 2 foods, and trust me, you do not want to miss number 1. If you've been getting value from this video, please take 2 seconds right now and hit the like button. It helps us reach more seniors who need this information. And if you haven't subscribed yet, do it now and ring the bell so you never miss a video like this one. We release evidence-based health content for adults over 60 every single week. Now, let's keep going, because what's coming next is even more powerful. Number 2, oats. Oats contain a type of soluble fiber called beta-glucan. Beta-glucan forms a thick, viscous gel in your digestive tract. This gel slows the absorption of glucose, preventing the blood sugar spikes that trigger inflammatory responses in arterial walls. It binds to cholesterol particles in the gut and removes them from your body before they can be absorbed. And it directly stimulates the production of short-chain fatty acids in your gut microbiome. These fatty acids signal the kidneys to increase sodium excretion, which, as we discussed with bananas, means lower blood pressure. Oats also contain a class of compounds called avenanthramides, antioxidants unique to oats that have been shown in research from Tufts University to directly reduce inflammation in vascular endothelial cells, the same cells that line your arteries. A meta-analysis published in the American Journal of Clinical Nutrition reviewed 28 randomized controlled trials examining the relationship between beta-glucan intake and blood pressure in adults. The results showed that consuming at least 3 grams of beta-glucan daily, the amount in approximately 1 cup of cooked oats, was associated with a statistically significant reduction of 2.7 millimeters of mercury in systolic blood pressure and 1.5 in diastolic. Let me tell you about Helen, a 77-year-old retired librarian who had been managing hypertension for over a decade. She was doing all the right things: no salt, walking 30 minutes a day, taking her medication faithfully, but her readings remained in the 148 to 155 range. I asked about her breakfast. She was eating toast with butter and orange juice every morning. We swapped that for a bowl of plain rolled oats with a handful of blueberries and a drizzle of honey. That was the only morning change. 3 months later, Helen's average morning blood pressure reading had dropped to 138/82. She called the change nothing short of miraculous. It wasn't a miracle. It was beta-glucan and avenanthramides doing exactly what science says they do. Oats every morning is one of the most evidence-based, side-effect-free cardiovascular interventions available to any senior alive today. But as powerful as oats are, the number one food on this list produces an effect so significant that the NIH funded multiple clinical trials to study it specifically for hypertensive seniors, and the results were extraordinary. Number 1, berries, blueberries, strawberries, and raspberries berries are extraordinarily rich in a class of antioxidants called flavonoids, specifically a subgroup called anthocyanins. Anthocyanins are what give berries their deep blue, red, and purple colors. And inside your cardiovascular system, they do something remarkable. They directly stimulate the endothelium, the thin layer of cells lining the interior of every blood vessel in your body, to produce more nitric oxide. They do this by activating an enzyme called endothelial nitric oxide synthase, or eNOS. Your blood vessels are essentially being signaled to relax, not temporarily, not superficially, but at the cellular level. Anthocyanins also reduce a key inflammatory marker called interleukin-6, which is one of the primary chemical signals responsible for arterial stiffening and endothelial dysfunction in older adults. By suppressing IL-6, berries aren't just lowering your pressure reading today, they're slowing the progression of the arterial aging process that drives hypertension forward over years. A landmark study published in the American Journal of Clinical Nutrition, conducted by researchers at King's College London and the National Institutes of Health, followed 150 adults with hypertension aged 60 and over for 8 weeks. Participants who consumed 1 cup of mixed blueberries and strawberries daily showed an average reduction in systolic blood pressure of 8.1 millimeters of mercury, a 6.4% reduction in arterial stiffness as measured by pulse wave velocity, and a 12% improvement in endothelial function compared to the control group. The researchers called it nutritional intervention with pharmacological magnitude. A separate study from the Harvard T.H. Chan School of Public Health followed over 34,000 women with hypertension for 14 years. Women who consumed the highest levels of anthocyanins, primarily from blueberries and strawberries, had an 8% lower risk of hypertension overall and demonstrated the slowest progression of blood pressure elevation over time. Let me tell you about Barbara. Barbara is 79 years old. She came to me 5 years ago, referred by her cardiologist after a minor ischemic event, a small stroke, that left her terrified and determined. She was already on 3 blood pressure medications. She wanted to do more. She wanted to feel like she was fighting back. We worked through her diet comprehensively, but the single most consistent addition I made was a commitment to a daily berry serving. 1 cup of mixed blueberries and strawberries, fresh or frozen, it doesn't matter because the anthocyanins survive freezing beautifully, every single morning with her breakfast. Over the following year, Barbara's cardiologist was able to reduce one of her 3 blood pressure medications. Her readings stabilized, her arterial stiffness scores improved. But what Barbara talks about most is not the numbers. She says she feels sharper, more energetic, less frightened of her own body. "I feel like I got some of myself back," she told me during her last visit. "You are not too old for this to work. Your body is not too far gone. Your blood vessels retain the ability to dilate better, to inflame less, to function more like they did decades ago, if you feed them the compounds that make that possible. 1 cup of berries. Every day. That is where your cardiovascular recovery begins." Let me bring this all together, because these 5 foods, when consumed consistently and in combination, don't just produce 5 separate effects. They create a comprehensive, synergistic program that targets every major mechanism of hypertension simultaneously. Spinach provides the nitrates that convert into nitric oxide, relaxing your arterial walls from the inside. Bananas supply the potassium that signals your kidneys to flush excess sodium and fluid, reducing the volume load against your vessel walls. Beets amplify the nitric oxide effect while delivering betalain antioxidants that protect vascular tissue from oxidative damage and inflammation. Oats provide beta-glucan fiber that improves endothelial signaling, reduces cholesterol, and stabilizes blood sugar, all of which protect the structural integrity of your arteries over time. And berries deliver anthocyanins that work at the cellular level, activating the eNOS enzyme, suppressing vascular inflammation, and measurably reversing arterial stiffness. Each food addresses a different piece of the puzzle. Together, they address the whole picture. This is not a collection of random healthy foods. This is a dietary protocol, one built from decades of cardiovascular research that directly targets the physiological mechanisms driving high blood pressure in older adults, seniors who take control of their nutrition, who understand what their bodies need and commit to providing it, don't just get better numbers. They maintain their independence. They reduce their need for medication. They reduce their risk of stroke and heart attack. They preserve the mental clarity, the physical energy, and the quality of life that medicine alone can never fully restore. You've survived every hard thing life has thrown at you so far. Your cardiovascular system has served you faithfully, sometimes under enormous stress, for 7 or 8 decades. It deserves your support now. And supporting it doesn't require a complete lifestyle overhaul. It requires intentional additions. Spinach in the morning, a banana as a snack, beet juice with breakfast, oats instead of toast, a cup of berries every single day. Every day you don't make these changes, your blood vessels are working harder than they have to. But every day you do, you are actively, measurably, reversing the course of your cardiovascular aging. That is not a metaphor. That is physiology. The choice is yours, and you have more power here than anyone has probably told you. If this video gave you something valuable, a new understanding, a new tool, a sense of possibility, please share it with someone you love who is managing high blood pressure. They need this information, and they deserve to have it. If you have questions, experiences to share, or just want to tell me what's working for you, leave a comment below. I read every single one, and I respond to as many as I can. Your story matters to this community, And if you want to continue learning how to protect your heart, your brain, and your independence through evidence-based nutrition, subscribe to this channel and hit the bell. We publish new content every week, and every video is built on real science, not generic advice. Thank you for watching. Thank you for caring enough about your health to spend this time here. It takes courage to take your health seriously, and you have shown that today. Go make these changes. Start tomorrow morning. Your blood vessels are ready to respond. I'll see you in the next video.